Are you a healthcare professional working with breastfeeding infants? Wish you knew more about assessing and treating tongue ties? Earn continuing education credits and transform your practice with the Professional's Guide to Tongue Tie in the Breastfeeding Infant. It's perfect for any practitioner who works with infants and their mothers, especially those working through feeding challenges. Learn to identify who needs treatment, build a qualified care team, and provide holistic care options. Discover the ins and outs of frenotomy, including procedure preparation and best aftercare practices. By the end, you'll be confidently supporting breastfeeding families armed with the latest protocols and be part of an interdisciplinary community of experts just like you. Tongue ties are nothing new, but the right way to assess and treat them is. Ready to make a real difference? Join now and become a tongue tie expert. Sign up today at tonguetieexperts.net/professional and become the evidence-based resource that your community needs. To show my gratitude, I'm offering you a special discount as a podcast listener. Use code PODCAST40 to save 40% off today. You're listening to the Tongue Tie Experts podcast, a weekly program providing information and support for those families impacted by tongue and lip tie and the professionals caring for them. I'm Lisa Palladino, a midwife and a lactation consultant with over 30 years of experience. If you are a parent looking for answers or a professional who is curious to learn more than what you learned in school on this topic, welcome. This podcast is for you. A gentle disclaimer. Please do not consider anything discussed on this podcast by myself or any guest of the podcast to be medical advice. The information is provided for educational purposes only and does not take the place of your own medical or lactation provider. Thank you. Hi, everyone, and welcome back to the Tongue Tie Experts podcast. This is Lisa Palladino, and before I play for you the full podcast episode, I just want to explain why it might sound a little different, and it's a short episode. I know it's summertime and we have a shorter attention span, and I'm actually on vacation this week, but I didn't want you to miss having an episode from me, and I wanted to be able to chat with you. So this episode is actually a recording of an Instagram live that I did last week. So it's addressing Instagram. Just want to explain that so you're like saying, wait a minute, I'm listening to her on her podcast. This isn't Instagram. And that's why. So if you don't follow me on Instagram, our brand new Instagram account is Tongue Tie Experts Podcast. And I'd love to see you over there. We do lives once a week. We have Tongue Tie Tuesday events. And we have lots of fun, lots of information for in between the podcast. And you'll also hear about when new podcast episodes are coming out. So thank you so much for listening, and I hope you enjoy this episode. Thank you. Good morning, everyone. It's Lisa coming on live on our new Tongue Tie Experts Instagram page. So if you've been following me for a long time as Tongue Tie Experts, you'll know that I asked you to move over to this page because my other account, Tongue Tie Experts, got hacked. So now we're Tongue Tie Experts Podcast for now, while we can play with that. Trying to get that back still. But for now, thank you. I am so appreciative for everyone who has followed me on my new Tongue Tie Experts podcast Instagram account. So today I'm coming on to talk to you about how do we know if releasing a tongue tie is actually going to help with breastfeeding problems. I get asked this all the time, and I'm going to try and answer it for you as much as I can. Okay? So how do we know? This is one of the most complex questions, and honestly, a dilemma is when a parent asks me if they should have their infant's tongue tie released, and that procedure is known as frenotomy or frenectomy, depending on who you ask. They want to know if it will be worth it, if it will solve the problems, if it's really going to make a difference for their infant. And these are great and necessary questions. Sometimes I wish I had a crystal ball and I could see into the future and let these families know for sure. But over the years, I have become better at discerning which infants will benefit the most. And I share this information a lot. We delve really deeply into this in my pro course, The Professional's Guide to Tongue Tying the Breastfeeding Infant. But today I will give you 4 aspects to consider beyond the typical assessment checklist. So this is what I use to evaluate the families that come to my office and make recommendations based on what I'm observing and assessing. Number 1, you want to be sure that there is a tongue or lip tie. Every baby has a frenum, but not every frenum is restricted. A visit to a pediatric dentist or other provider who can perform the surgery to release the frenum is not typically the best evaluation for knowing if there is a tongue or a lip tie. Now, of course, there are exceptions, but most medical providers are not performing a functional evaluation of the breastfeeding dyad, right? So the parent who's breastfeeding or the baby together or the baby and mother separately. Usually it's just the baby being looked at, right? They look in the mouth and ask them questions, but you really need a functional assessment to make sure that there is a tie. Because you want to know that the restriction or the frenum or tie is causing problems with the movements that are affecting breastfeeding, right? And an IBCLC is usually the best professional to see regarding this. Sometimes an SLP is helpful with babies with complex sucking challenges, and I refer to SLPs often, but especially if they're bottle fed, right? So if you're a professional taking care of families who are wondering about tongue tie release and you're not an IBCLC, if it's a breastfeeding family, recommend to breastfeeding an IBCLC. If it's a strictly bottle feeding family, I usually would say go straight to the SLP or speech language pathologist. But either of those professionals can do a thorough assessment of the muscles of the face and the oral motor system that needs to work in order for breastfeeding to happen. So number 2, we want to determine, so these are the 4 aspects that I consider when I'm trying to guide a family about whether releasing the tie will solve their breastfeeding problems. Okay, so number 1 was be sure there is a tie. Number 2 is determine if there are other problems or reasons or situations that might be interfering with breastfeeding success. Now, this can be complicated, and I can do a whole episode on other reasons for breastfeeding challenges or reasons for breastfeeding challenges in general. But for now, I'll list a few for you. 1 is low milk supply, parent depression or exhaustion, maternal anatomy, infant anatomy beyond the mouth, parent recovering from a C-section or difficult labor, a traumatic birth, separation at birth, such as a NICU admission, or a maternal health concern. Also a need for supplementing bottles, which sometimes there's a need, but that can interfere with breastfeeding success. Something I see often is lack of experience or support in understanding how to breastfeed. This can include how to hold a baby for best latch, how often to feed a baby, how to recognize feeding cues. Any of these complex situations can interfere with the initiation and continuation of breastfeeding, and if possible, should be addressed before considering frenotomy. Because if we release the tongue tie and we don't take into consideration those other situations, we will not have successful breastfeeding, or things will not get better. So number 3 on the items I consider when advising a family if having a frenotomy will help their breastfeeding is that the parents are prepared for frenotomy. This includes knowing what the procedure will be like, practicing exercises and stretches before the procedure, having a plan in place for pain management if the infant seems uncomfortable, and having a written care plan for the night of the frenotomy, the days and weeks following. This is not something to do and ask later, now what? Or have it done when you don't have the time to devote to aftercare. The aftercare, the stretches, the exercises, in many cases are just as important as the procedure itself. So instead of, if you are a professional interested in learning the protocols that ensure your patients will be prepared for the frenotomy procedure, you should check out the Professional's Guide to Tongue Tie in the Breastfeeding Infant. It's all included there, including handouts for your patients. If you want, you could find that at tonguetieexperts.net/professional course. Okay, so that's 3. I promised 4. I'm trying to get through this fast for you. The infant is being treated with a team approach that ensures better success in my experience and the experience of those I network with. We know that, a team approach is important. Now, is this baseball? For those who know me, you know that I'm a baseball freak. Diehard Mets fan. Don't hold it against me. Holding out all hope for this year. But this isn't baseball, but it's still a team approach. This is a medical procedure that requires a holistic assessment and recovery plan. Who is on the tongue tie team? My A team. My ideal recommendation for breastfeeding infants is an IBCLC, as I said, possibly an SLP, a body worker, a provider for frenotomy, and then rinse and repeat until you are on the way to reaching your goals. Quick definitions here. Who are body workers? Body workers are many types of professionals, can include chiropractors, osteopaths, physical therapists, occupational therapists, massage therapists, CST providers, etc. And who are the medical providers for frenotomy? That may depend on your location, but in general, most often it's a pediatric dentist. There are some ENTs who are well-versed in this procedure for infants. There are some general pediatricians, there are some nurse practitioners, advanced nurse practitioners who can do the procedure, but most likely the best trained will be the pediatric dentist, and I hope I'm not offending anyone in that. Just a generality, not trying to diss anyone. Okay, so for more information on that topic, Season 1, Episode 2 is dedicated to the team approach. So check out the Tongue Tie Experts podcast, and you can find that if you're not listening to the podcast now, you can find the Tongue Tie Experts podcast on Apple, Spotify, Google, or wherever you listen to podcasts. And it's Season 1, Episode 2 about the team approach. So whether you're a parent deciding for your own baby or a tongue tie team member guiding the decision for frenotomy or frenotomy timing with the families who come to you for guidance, I hope that the 4 considerations that I listed here provide insight. Frenotomy is not a procedure to rush into, and we all want the most successful outcomes for our families and for the patients in our care. So if you are looking for more information on the parent side, the link for our Parent's Guide to Tongue Tie is below. You can always use podcast 15 to save 15%. And that's a complete guide to get you through assessment, through the procedure, and the aftercare. If you are a professional, now is the best time to sign up for a professional's guide to tongue tie in the breastfeeding infant. Our annual summer sale is going on now. The link is in the notes, but it's www.tonguetie.net/professional course. The course is multidisciplinary. You can join if you are any professional who fits on the tongue tie team. The course provides 4 LCerps for lactation consultants and membership in a community for continued support, learning, and networking. Again, apply at tonguetieexperts.net/professional course. If you're listening to this on the podcast, the clickable link is in the show notes. On Instagram, it will be in my bio. And just remember that the half price sale is the summer sale. So it's half price now for professionals. It's a great time to join. And I hope to see you in the group. Thank you so much for listening to this week's episode of the Tongue Tie Experts podcast. Check out the show notes for useful links about the topics we discussed and for ways to follow us on social media. Please subscribe to us on your favorite podcast app. And if you enjoyed listening, we'd love it if you'd rate, review, and share with your friends and colleagues. Thanks so much. Bye-bye. Tongue tie cases can be confusing, but what if you had a place to ask questions, learn from experts, and connect with professionals who truly understand? That's exactly what you'll get when you join Tongue Tie Experts Insiders. It includes monthly online meetups with me, Lisa Palladino, expert guest speakers sharing the latest research and best practices, a private community of other professionals ready to support you every step of the way. For just $19.99 a month, you'll never have to navigate tongue tie cases alone again. Join the community today. Your future self and your patients will thank you. Sign up now at tonguetieexperts.net/insiders.